Hello, I am Arnav. I am an orthopedic surgeon and I cleared my MRCS Part B exam last year in July 2019. It was my second attempt and my first attempt was on March 2019 and I failed by 3 marks in the skills part. So I didn't know where I went wrong. And after I enrolled for the Kaveri MRCS course, I came to know about my drawbacks. So basically, in my first attempt, I focused more on the theory part. I mean, reading stuff because the whole syllabus of MRCS is based on general surgery, and as an orthopedic surgeon, it was all new to me. So I focused on reading general surgery stuff, and I didn't focus on the communication part. So that's where I went wrong and I failed by 3 marks in the skills part and I scored the least in the communication. So basically this exam is all about how you communicate with your patient and how you communicate with your colleague. That's how you pass this exam. This exam doesn't only test your knowledge, it also tests your communication skills, how you can perform in an emergency setting, how you can perform in a routine setting, how you can I mean talk to an angry patient, how you can talk to a patient who is not happy about his treatment and who is anxious about something. So how you deal this situation is very important and this exam focuses on those things only. So after I enrolled for the Kaveri MRCS course, I came to know that how you can pass this exam. Basically, the communication part is the most important. How you break the bad news to a patient. That's a very tough job. But this course taught me how you can do it with ease. So the main focus of this exam is communication. Practice daily with your colleague or friend, history taking, examination, and also practice the procedures like suturing, abscess drainage at home on a model on a piece of paper. You can do it easily. And suturing, you can collect some instruments from your hospital and you can try on the bed sheet or any piece of cloth at home. That way you get more confident with the exam and in the exam you perform very well. So basically this exam is all about practice and practice. You practice every day, you do very well in the exam and you can pass with certainty. And the entire faculty of Kaveri MRCS course is very experienced and the things they tell are very important. Mainly Indian candidates, they fail in the communication part because we are very good at reading, but when it comes to communicating, we do very very bad. Although we think that we are doing it right, but we don't do it well. So my advice to all of you is practice communication very well. Practice old questions of MRCS Part B. You will find them on the Kaveri MRCS group. And previously there was a MRCS resource website, but that has gone down. So all you need is to collect this old question and practice them again and again. MRCS is the exam of repeats. All questions that come, they're all repeats in previous exam. So you just need to practice those scenarios and go for the exam and you can pass with ease. Regarding the knowledge part, you don't need to worry. There are a lot of notes available in the market like the Turkey notes or the Sing notes. You can read them up and you can easily pass in the knowledge part. In the skills part, you need to practice again and again and do practice with a colleague of yours. That way you will be doing well actually, and you can also get a feedback from your colleague about how you performed. And if no one is available, then practice with someone who is prepared for the exam via WhatsApp call, video call, or any Google Duo, so that way you can practice again and again, and you get over the phobia of the exam. This exam is all about practice, because you have to perform everything with a limited time. So you have to be very careful about the time, and you have to complete the thing within a definite time period. There is a separate marks for that also, that's called professionalism. You have to complete everything in a definite time. You have to follow the proper etiquettes, like saying good morning, thank you, and also washing hands. That is also very important. All these things count. Also, during history taking, you should have proper eye contact and a proper body language. You should keep eye contact. You should be interactive with the patient, uh, like appreciating if he does something well. Also, sometimes reassuring him, so that way you get interactive with the patient, and that improves your communication, and it make gives you good marks in the exam. So basically, this exam is all about practice. I would like to focus that is it is a very easy exam to pass, and it's not at all difficult for an orthopedic surgeon to pass this exam. I passed in my second attempt because I did wrong in my first attempt, but I would like to tell you that don't do the things that did wrong in my first attempt. Don't go on reading theory. Don't I mean don't neglect the communication part. If you don't practice, you can't go and perform in the day of exam. You should have good practice. Only then only you can pass in the communication part. And also, I would like to tell you that I have my post on Quora on how to pass part B exam, so you can go through that post and you will have a proper idea about how this exam works and how you can perform well in every mm, module, like the skills part, I mean the examination part, the history taking, the communication. So you can have an idea about how you can pass this exam by reading that post. So I'm very thankful to the Kaveri MRCS course, because this is the best course I have I know. And I have also attended the Royal College courses, but I didn't find them very useful, because they don't give a proper idea about how the examination works. The I came to know the importance of communication only through this Kaveri MRCS course. So, friends, note down all the points that the faculty of Kaveri MRCS course tell, and prepare for the exam by practicing with someone. That way you will do very well. This is a very easy exam to pass, and MRCS is a very fair exam. It's not like the Indian exams where you just mug up things and pass. This exam test your knowledge and your communication, how you apply that knowledge. That's the main thing, and that's a part of our life. That's a part of our medical practice, about how you communicate with the patient, because maximum medical legal errors, I mean medical legal complications that occur, they occur because of lack of communication. So basically, practice for this exam again and again, and you'll definitely pass. I like to close my discussion now. So thank you everyone, and best of luck. You can easily pass this exam.